Welcome back for another podcast with me on one of my favorite subjects. It all encompasses leaky gut, dysbiosis, and autoimmune disorders, and we'll talk today about how all of these are linked together. This is another Priority Health Academy nano-podcast on functional medicine topics. It's another moment with Dr. Salibi. What is leaky gut? Well, let's define it first. So leaky gut, otherwise known as gastric permeability, is a medical condition where the intestinal lining in our villi, which is that little frilly border that separates the outside world from the inside world, is more porous than it should be. The barrier between the outside world, which is the tube between our mouth and our anus, and the inside of our cells, which is our internal organs, bloodstream, all that kind of stuff, is disrupted. This barrier is made up of cells that have tight junctions that connect them together, kind of provide a barrier. Think of it as a protective brick wall around a walled city. When something disrupts this protective layer, then all things start to leak through. Think of an invading army that breaches the wall of a fortified city. Once that happens, then the whole army can come in and invade that city. When things start leaking through, such as foreign material, proteins, big carbohydrate molecules, then the body's immune system kind of ramps up to protect us because it sees these invading entities as invaders. Okay, in war we would call them invading soldiers or troops. In medicine we would call these things antigens. The normal, innate, or natural immune response that our body has is to generate antibodies and in such an inflammatory cytokine release. Now, prolonged inflammation is not good. Small bouts is okay, but when it goes on forever, or for an extended period of time, that's not a good thing. Because of something called molecular mimicry, at times our own body and its immune system may attack itself and the tissues and organs, believing that the same antibody is supposed to be attacking an invading antigen, but in fact it's attacking our own body and tissue and organs. And this is, by definition, autoimmunity or an autoimmune disease. Now, this is an artist's rendition of tight junctions. As you can see, there's cell walls represented by this tan material. Cell A and cell B are adjacent cells, and in between them that kind of binds them or locks them together are these things called tight junctions. So things cannot really slip through between the cells, and that's how it should be in a normal tissue. Let's revisit the analogy about a walled fortification, which represents a cell surrounded by an intact membrane or tight junction. So here's a depiction of a European city that's surrounded by protective layers of a fortified wall. And the right bottom picture shows the Trojan horse of the Great War, where the Greeks kind of tricked the Trojans into breaking down their wall to allow their gift, which was a Trojan horse, which had soldiers in it, through. So once the wall was breached, then the Greek armies could invade and destroy Troy. This is depicted by an invading army. There's a picture of some troops there getting ready to make an invasion. And it's depicted in biology in the upper right-hand corner by cells with invading microorganisms. So you see some loosey-goosey cells there that are depicted in sort of that gold yellow color, and then the red colored are bacteria that are actually slipping through those gaps in the cell, in between the cells. So I'm often asked, what can cause leaky gut? Well, several things. One is a non-modifiable predisposition based on your genetics. So some people have just bad genetics, and it makes them predisposed to getting leaky gut in the first place, while others have pretty robust genetics and they're not as susceptible. The second is a very important trigger and aggravating factor, and if not taken care of initially, can allow for the propagation and worsening of leaky gut, and that's food sensitivity or food allergy. The third thing that could be involved is the disruption of the gastric microbiome. Now, this can go back to when you were a little kid getting antibiotic after antibiotic for otitis media, let's say, and it disrupts the normal balance of good bacteria in your gut. So this imbalance can go on for years, and you may be encumbered with pathogenic microbes from overuse of antibiotics or poor diet or other malnutrition or the ingestion of some pathologic microbes or pathogens or parasites. This all comes together to cause dysbiosis or SIBO, small intestinal bacterial overgrowth. If the two modifiable reasons, such as the food allergy and the leak and the dysbiosis, are not addressed, it could result in a worsening picture as time goes on, which can lead to disability and chronic illness. Everyone has a different tipping point, and some folks can go on for years with a mild leaky gut that doesn't really manifest as anything symptomatic. But eventually that tipping point is reached due to increased stress, an infection, a hospitalization, a car accident, something like that. And then things start to manifest. And so putting out that big fire of runaway leaky gut after years of neglect can be quite a daunting task and quite frustrating for both the patient and the practitioner. Fixing the leaky gut at that point and having to address all the collateral damage may take months to years to fix. This is an illustration talking about or representing tight junctions that are intact with a healthy gut, and those are depicted on the left. And then you see the breakdown of the tight junctions and the degradation of the cells and the cell wall areas, all based on the use of antibiotics, food allergy, pathogenic microbes, stress, whether it's physical or emotional, and environmental toxins. They all contribute to a GI inflammation, and the tight junctions are broken down, and that further fuels this sort of dysbiosis and leaky gut, and eventually leads to autoimmune disorders. So what is the connection between leaky gut and autoimmune disorders? Both of these topics could be hour-long lectures in and of themselves, but there's in the neighborhood of some 100 or so different autoimmune disorders that the medical community has thus named. They are essentially, they attack different organs and tissues in different ways and manifest themselves based on organ involvement. For example, an autoimmune disorder of the brain tissue, where the myelin sheath is attacked by antibodies and break down that protective layer around the nerve tissue, may manifest itself as plaques seen on an MRI on a patient with MS. Another example would be where autoimmune antibodies attack the skin and develop a particular dermatitis called psoriasis. So both MS and psoriasis are classified as autoimmune diseases. There's a different pathology, but basically the same root cause is what's responsible for both. So really in my practice, I don't care what you call it. You can call it MS, you can call it ALS, you can call it Hashimoto's, you can call it psoriasis. But basically, when it comes down to brass tacks, you treat it the same way. And the basic tenet is that it involves a dysfunction of the innate or natural immune system. And it can come by different names, but essentially it's the same root cause. One of the main causes of autoimmune is having a leaky gut caused by an altered immune system. Here we have a depiction of normal versus autoimmune disorder. On the left, you've got body tissues that are not being attacked by a normal immune response, which is attacking a microbe depicted as that gold body in the picture. On the one on the right, you see that the antibodies are also attacking the gold microbe, which is a foreign material, but it's also attacking our own tissue. And when antibodies from our own immune system are attacking our own tissues, that's autoimmune. And it's destructive. So it'll destroy cartilage and you get autoimmune arthritises. If it attacks the thyroid tissue, then you develop a condition called Hashimoto's, which is an autoimmune thyroiditis. And the list goes on. Now I'll talk a little bit about SIBO and its connection to leaky gut. So SIBO, S-I-B-O, stands for small intestinal bacterial overgrowth. It's also referred to as dysbiosis. And because medical societies like to make things more complicated when they really aren't, they've been subclassified into two groups of SIBO. So one type of SIBO is hydrogen predominant SIBO, and the other is methane dominant. And this is based on testing where you blow in a bag after taking a particular agent, and if you produce a lot of hydrogen gas or HCl, then you're categorized in one. If you produce a lot of methane gas, then you're in the other group. But basically, SIBO is SIBO. And it can be a distraction, and patients always want to be over-tested for stuff. So they kind of make a mountain out of a molehill when actually, instead of spending thousands of dollars on testing, they should be spending that money on therapy. What really matters is that you must regain the proper balance of good microbes, whether they're methane or hydrogen producing microbes in your gut to cure SIBO. Curing SIBO will eventually take one of the biggest offenders out of the picture. Fixing SIBO or dysbiosis and eliminating the aggravating foods that you see in food allergies that cause leaky gut can resolve the whole body system that's in disrepair to a more healthy picture and can eliminate or reverse autoimmune disorders. This is an illustration or a cartoon showing our small and large bowels. They're in pink, and a series of different microbes, viruses, pathogens, parasites, as representing a dysbiotic gut. Well, once we've made the diagnosis, how long does it take to fix leaky gut? The fix for leaky gut depends on identifying the causes and the factors that can cause them. Is it a food allergy? Is it an environmental toxin? Is it the overuse or constant use of antibiotics, let's say? Also, correcting the dysbiosis once it has been identified. Sometimes dysbiosis or SIBO can be resistant to therapy, or after treatment it can reoccur. That's not an uncommon problem. One must follow very carefully the recommendations of your functional medicine physician to complete the healing process of the gut. This may involve very strict dietary restrictions, such as an elimination diet, or worst case scenario, something called the elemental diet. Healing the gut may also involve recolonization of the gut with proper microbes and the use occasionally of other agents, whether natural or synthetic antibiotics, to remove or kill off the microbial pathogens that colonize the gut. Also, a healing or patching up of the tight junctions has to occur once the inflammation in the gut has settled down. And there are agents to help bring that to reality. Finally, when the leaky gut stops leaking, one may notice a return to health and amelioration of some of the downstream collateral damage like autoimmune disease. I must remind my patients that this does not happen overnight. Healing can take months to even years for gut health to return to normal. So the patient must have some patience with this process. As I mentioned before, if you fix the leaky gut, sometimes the autoimmune resolves. And there is a link between the two. The process of healing leaky gut can be quite lengthy, but the process of correcting an autoimmune disorder is even much more tricky and can take even a longer period of time. Because the first step is to avoid rekindling the fire of autoimmune. Leaky gut and other factors need to be fixed and fixed completely. Second, the way our immune system works, there are T cells and B cells that work in synergy with one another, and the B cells contain memory of an associated exposure to an antigen, whether that antigen is a virus or that antigen might be a food that you're sensitive to. That is how our body continues to protect ourselves aggressively against foreign invaders, such as viruses, parasites, and bacterial microbes. If, however, it's a food, that becomes a problem because B cells that produce antibodies generate their daughter cells, or what they call memory cells, that carry on this sort of antigenic memory to protect ourselves from future invaders. And those cell lines can propagate for many years. So let's say you give up gluten and you've been without a gluten challenge for 6 months. And then you cheat and have a little piece of birthday cake because you just can't help yourself. Well, presto, all of a sudden, that little bit of gluten sparks this huge immune response because now your immune system is woken up and it takes on a heightened response. This is good if the invaded organism is a nasty virus, but it's not good when it's a piece of gluten in food that you should not have been eating. And it can cause a flare-up that can last for weeks. This image depicts some B cells that produce the antibodies. And you see that downstream from that, you have these what we call memory B cells or daughter cells. And those are the ones that can propagate for months to years, or years and years, producing antibodies when exposed to an antigen. We'll talk a minute about testing. So I recommend an expanded food allergy testing, not only to check IgE or IgG, but actually IgE, IgG subtype 4, and a type of complement. That's one way to do it. The other more burdensome, complicated, and long-term way is doing an elimination diet, where you eliminate a lot of foods and then you slowly reintroduce, and you have to base it on your subjective feeling. That doesn't give hard data. It's not data. It's more of just subjective entries in your diary of what foods you might be sensitive to. The other thing is to check zonulin levels, either stool or serum zonulin, which is responsible for leaky gut. So the higher the zonulin level is, the worse your leaky gut is. Another thing you can check are LPS, lipopolysaccharide antibodies, and that's kind of the waste product, if you will, of gram-negative bacteria. So if those are sneaking through the tight junctions and getting on the inside of you and sparking an allergic reaction, that's a good indicator that the higher LPS antibody titers are, the leakier your gut is. Another thing you can measure is histamine and diamino oxide, which is the breakdown enzyme for histamine. That can be helpful when you're trying to determine if a histamine allergy is another factor. And then if you're not sure about a diagnosis of IBS, irritable bowel syndrome, versus IBD, that's a inflammatory bowel disease such as Crohn's disease or ulcerative colitis, and the person hasn't been scoped yet or biopsied, you can run some stool tests utilizing calprotectin and lactoferrin as non-invasive tools to determine if it's IBS or IBD, which can be part of this whole SIBO issue. A lot of people come in complaining of IBS symptoms, and that initiates the workup to begin with. The other thing we use is microbiome testing. So we check the stool for microbiology, or you can do a more elaborate CDSA, which is a comprehensive diagnostic stool analysis. Sometimes there's a lot of fluff in that, and it's not useful information, to be honest. And then ultimately, if somebody has not been scoped and you want to make sure you're ruling out other nasty things, you can order a colonoscopy. Finally, I'll talk about what needs to be done to fix leaky gut. And these are the very basics. This is the most minimal stuff that you would need to do. And it should be overseen by a knowledgeable functional medicine physician because it's not really easy to do on your own. So you want to eliminate the offending foods. You got to not add fuel to the fire, so to speak. So after you have your allergy testing, you need to really adhere to a diet avoiding those foods that showed up positive on your test. We use probiotics to recolonize the gut and try to bring it into more balance. We use vitamin D as an immunomodulator. So if people have low vitamin D levels, which we see a lot of, we do an aggressive replacement or supplementation with vitamin D3. Oftentimes we add glutamine in because glutamine helps repair the tight junctions and helps with repairing the kind of damaged cell wall or intestinal lining. The use of high-grade fish oils or non-fish-based omega-3s such as EPA and DHA are good to use as anti-inflammatory agents to help put out the fire. We also use things like curcumin and other natural anti-inflammatories like quercetin or resveratrol to quell the fire of inflammation. And sometimes, when appropriate, we may use colostrum to heal the leaky gut. And potentially, as far as pharmaceuticals go, we can use low-dose naltrexone, or LDN, as an agent to help suppress autoimmune and also to help fix a dysfunctional immune system. And research has shown that LDN has also been shown to help heal leaky gut and fix mucosal lining directly. Well, this wraps up our little nano-podcast on leaky gut and the links to dysbiosis and autoimmune disease. Now, this has been a moment with Dr. Salibi, brought to you by the Priority Health Academy. If you would like more information on our center and our providers that can help you with issues with leaky gut, with autoimmune disorders, and with other issues you have in a functional medicine setting, please contact our office, carolinaholisticmedicine.com, or give us a call on our toll-free number, 800-965-8482. And I look forward to seeing you next time for another podcast.